Hello, I'm Sophia Nagorski, and today I'm presenting my Chem research project about medicine. So first of all, we are thinking about how and where does our topic show up in everyday life? Well, we think about homes, cartels, hospitals, pharmacies, nursing homes, and then we're also wondering about how there's different types of medicines and just the different types of them, and are there people living off medicine? So let's start with hospitals. The number of drugs given or prescribed is 368.5 million in 2017 alone. We're also thinking about pharmacies. So there's about 300 medications doses filled by technicians daily at pharmacies, which is kind of insane. We also have many nursing homes which are giving old people our prescriptions to keep them alive, which is great. And then we're going to talk about the drug cartel, which is interesting because how would medicine factor into the drug cartel? Well, actually, 24% of the drugs in the cartel are medicine, which probably isn't that important, but I really think it's an interesting fact, especially because the rest of it is going to be about the medication. So, many people take medicine to feel better and promote well-being of themselves, and the percent of persons using at least one prescription drug in the past 30 days is 48.4%, 2013 to 2016, which is kind of insane to me. Some people take drugs because of addiction or substance abuse. Some are living off of it. But now we're going to get into the different types of medication. So first we have liquids like NyQuil, Dayquil, and Mucinex, which you drink or, they go down your system, and that's a liquid. And then we have capsules, which include Advil, ibuprofen, acetaminophen, and also birth control. And then injections are birth control and vaccines. And those are most likely, or they are, not most likely, they are injected into your arm or leg or wherever it is best suited for it to be injected. And then there's also tropical medicines, which are like lotions or creams or something like that. So a lot of it's used for like rashes or eczema or ringworm. So next we're going to be talking about how is it significant or relevant to Neolithic society. Well, medicine is really everywhere. It might not look the same everywhere you look, but as the world, it's seen in different columns. So it's just really interesting to learn about all the different topics about medicine, because there's so many different types of ways that it is used. So medicine is constantly evolving as well. New tech and medicines and vaccines are constantly being made by scientists. And in that little section, the COVID-19 vaccine just came out, and we know that they were working on that for a while now. So it's just kind of interesting because we weren't sure if we were going to get a vaccine this soon, but we actually did. Medicine can fix and possibly heal a lot of things. So if you have a headache, you can take medicine. If you have a runny nose, you can take medicine. There's so many different types of medicine these days where it's really easy to find something that will help what you're feeling. So then the next one is how does my topic intersect with human culture in connection to different cultures? So first, there's many types of doctors around the world. We have pediatricians and we also have surgeons, but we also have types of doctors that do like acupuncture and things like that, which is really interesting. And then we also have herbal medicines, which many medical people believe in wise tales about medicine, and there's just a lot of wives' tales out there about medicine, and they're really widespread, so that's really connection with the human culture, because some people will say, oh, if you go outside without a jacket on, which I don't know if that's scientifically proven, but that's just the one that comes to the beginning of my head. So then we're going to talk about how medicine is such an individual and local based thing. So it's individual in the meaning that if you are feeling pain, no one can know the pain that you are feeling yourself. It's just different for everyone, and it's doctors versus patients. It's a really interesting subject. So, and then next we're going to be talking about geographical connections. So we have Eastern medicine versus Western medicine, and then we also have I just put many there. So Eastern medicine is Oriental or traditional Chinese medicine. It's actually one of the oldest medicines known today. There's many mind and spiritual beliefs, and there's mostly natural forms of healing, such as herbs, acupuncture, nutrition, mind and body exercises like yoga or Tai Chi or massage. But then Western medicine is called conventional medicine, which is doctors, nurses, pharmacy techs, and all the places that go into that. So what Western medicine is, it's you identify the issue and then you treat it. And it's more scientific based than the Eastern, but many people use both forms of medicine throughout their life. So next we're going to be talking about the ethical, societal, and environmental issues. This was the part of the research that was my favorite part personally. So some different medicines are not actually available everywhere you go. So I didn't really go in depth to that part, but if you go over to Africa or China, they might not have like Dayquil or whatever. But on the other side, there's cultures and religions that frown upon treatment/medicine. So I'm going to go through the different types of cultures and religions. So first, Amish people, they do not allow heart transplants, and sometimes they don't even allow heart surgery in general. They use homemade remedies such as herbal teas. They do not allow birth control, and they avoid like screening. So if you want to go get like an x-ray, they will not allow that for the most part. I do not know how to pronounce it, but it's Chiite, Muslims. And they do not accept any form of drugs at all. No implants with porcelain, and will allow emergency surgery. So if someone gets hit by a car and they are life-threatening, they will allow an emergency surgery for that. And then for the Jehovah's Witnesses, they don't allow any blood transfusions at all, which is really interesting. And then Christian Scientists, they believe in healing through prayer and are against modern day medicine, and they have like a healing like atmosphere, and they don't really enjoy going to doctors, or they won't allow it in general. And there's many more cultures, but I just couldn't get into all of them, or else we would be here all day. So next we're going to talk about anti-vaccinators. So they are people who believe that vaccinations are unsafe and infringe on human rights that everyone has. Some people call it the devil's work. It is believed that vaccines are linked to causing autism in children. There has been many protests and petitions out to stop having our children vaccinated. In my own opinion, I believe we should be vaccinated. And as a doctor, they are allowed to break few cultural beliefs due to things, but most people find this like unethical, especially because it's not what they want. But it includes if they have an altered state of mind. So if they're on any type of drugs or alcohol, I believe they are able to do treatment on said person. And also if they are under 18, then they can do anything. And there is a lot of discrimination in the medical field. Some patients will refuse to get help from doctors and nurses if they are not white or a male. Doctors making assumptions and stereotyping about patients is a reoccurring fact, along with people believing that males cannot be nurses. And there's so much more to go into that with that too. So then there's a lot of So then we're going to talk about the historical aspects, and that includes widespread sickness, evolving and improving, and vaccines. So, as we've talked about, medicine is constantly evolving and improving. Doctors and nurses are constantly learning new practices, technology. Some are going back to college, and it's actually strongly recommended to go back to college to learn the new like technology and ways to treat patients, and it's just really important like that. Actually, the gender is becoming more balanced in the medical field, which is great to hear. And scientific labs are currently learning more information about medicines and vaccines. So next we are going to talk about vaccines, which is actually really relevant now, especially with the COVID-19 vaccine coming out. So the first vaccine ever was in 1978 they would inject cowpox in you to fight smallpox, which is actually really interesting. Before that, they had other types of vaccines, they would call them, which would include like drinking snake venom to be immune to snake bites, and that was performed by monks. And it takes a lot of time, as we know, to create the science behind them. And next, we're going to be talking about the chemistry behind medicine right there. So, how does chemistry work? Why do some medicines work better than others? And how effective are vaccines? So, how does medicine work? So, if we're talking about capsules, you're just going to swallow it. And then your digestive system will break it down, and it'll get released into your bloodstream. And they'll deliver it to the correct part of your body, which is really interesting to think about. It's like, how does it know that this is where it needs to go? But not all medicines are like that, including insulin, because you don't want to inject it into you and to go to your bloodstream, so you just want to put it right there, right there. Some meds would take too long to work if they had to break down. That's why it gets injected right into your bloodstream, like IVs. Some meds need to be applied like creams to work in the target area, ear infections, infected cut, which is the tropical medicine we talked about previously. Lung issues need to be fixed. They need to be like breathed in. I don't know if that's the correct wording of it, but it's not like traditional medicine. You need to breathe it in. You need to, yeah. And then how effective are vaccines? And again, this is really relevant. So once you're injected into your body, so this is how it works, first of all. It's injected in, and your body sees that as a foreign substance and starts making antibodies. The antibodies' job is to destroy the germs. The second job is to stop further injections if it's the same time if it gets injected in, destroying before they make you sick. So if you get a childhood vaccine, it's 90 to 99% effective. And if you were to get the sickness that you had a vaccine for, it'd be less serious than someone who hadn't had the vaccine. And the next thing is I wanted to know personally was why do other medicines work for me better than others? And it could possibly be the slightly different ingredients in one medicine to the other, but most of it is actually in your genes. And they're creating this new thing called precision medicine, which hasn't been released yet, but they will test your genes and find the best fit for you. And I'm just going to give you a little close-up of the board. There you go. I'll send you a video of it. Thank you.